And go ahead.
All right, we're looking at the nasal cavity, the nasopharynx, the oral cavity, and the oral pharynx. This is the superior meatus. Remember, the sphenoid sinus drains into the superior meatus. The middle, if we flip up the middle meatus, we would see the ethmoid bullae, the opening to the frontal sinus, opening to the maxillary sinus, and the hiatus semilunaris. This is the inferior concha, inferior meatus. If we open this up, we would see the opening to the nasolacrimal duct. It's just a reminder for studying for boards. As we move back here, we should see right here should be the location of the pterygopalatine ganglia. Heading south out of the pterygopalatine ganglia should be palatine nerves, which would come down through the greater and lesser palatine foramen to innervate the roof of the mouth. As we move back into the nasopharynx, this is the opening to the eustachian tube or opening to the auditory tube. This is the tensor villi palatini, which is innervated by mandibular branch of trigeminal. This is levator villi palatini and salpingopharyngeus, which are innervated by vagus. This is the pharyngeal tonsil, also known as the adenoids. As we come down, this is the pharyngeal constrictor muscles. The superior, middle, and inferior pharyngeal constrictors are all innervated by vagus. They're just in front of the anterior longitudinal ligament. As we move down here to the palate, we have palatopharyngeus and palatoglossus, both innervated by vagus, and they're on either side of the palatine tonsil. As we look at the tongue here, we've got the genioglossus. On the outside, we would also have, genioglossus innervated by hypoglossal, geniohyoid, which is innervated off of the cervical plexus, mylohyoid, which is innervated by mandibular branch of trigeminal. We move down, this is the lingual tonsil. Remember, this is the foramen cecum, which is a remnant of the thyroglossal duct. We move down into the pharynx-larynx area. This is the epiglottis. These are your laryngeal muscles. This is the thyroarytenoid. This is the laterocricoarytenoid. And back here we have the oblique and transverse arytenoids, as well as the posterior cricoarytenoid. Those are all innervated by vagus, specifically the recurrent laryngeal branch of vagus. I think that's all on this one.